right, and here we go. So thank you everybody for joining us today. We greatly appreciate it. We are doing a little bit of a different media briefing from UNC Health this morning. We're going to talk to the leader of the UNC and Jaycee's Burn Center in Chapel Hill and talk about what that organization does and how they've been affected by COVID and sort of the experiences that our expert has gone through. Again, we will record this unedited, and we will provide the files for audio and for video immediately after the briefing is concluded. So at this point, I will turn it over to my colleague, Alan Wolf, and Alan will introduce our guest speaker. Alan?
Thanks, Phil. Good morning, Dr. King. Good morning, everybody. In March, just before the pandemic began, Dr. Booker King became chief of the Burn Division of Surgery and director of the NC Jaycee Burn Center at UNC Hospitals in Chapel Hill. He joined UNC Health after an illustrious military career. Dr. King is a decorated colonel, having served more than 20 years in the Army, earning 2 Legion of Merit Awards, 2 Bronze Star Medals, and 4 Meritorious Service Medals, among multiple other military honors and awards. He has been an active member of national surgical organizations. His publications have focused on burn injuries and trauma, with a particular emphasis on those received in combat. Dr. King, thank you. Would you like to make a few opening remarks before we open this up to some questions?
Just thank you for excellent introduction there, and just glad to be here, and just glad to be able to relay what we do here, the good work that we do here at the Burn Center.
Dr. King, do you want to talk a little bit about what you've seen since you joined in March? I know that things are nowhere near normal, but the Burn Center is seeing patients because of the pandemic or related to the pandemic.
Well, operations in the Burn Center haven't lessened. In fact, in a few cases, in a few different populations, it's actually increased. So one of the things that we've seen early on in the when the shutdown occurred is an increase in the pediatric patients. We actually reported on this in the literature. We've seen an uptick, and what we think was happening is normally those school-age children, the majority of them are school-age, would be obviously in school, and since they were at home, that puts them more at risk for things that happen at home. And a lot of these were just basic things like pulling hot soup off the table or grabbing a pan off the oven. But all those different types of injuries obviously occur in the home environment. And when the shutdown occurred and the kids weren't allowed to go to school, we saw a definite increase.
What advice would you offer to parents and families who are still stuck at home in many cases? Although schools are starting to reopen, there's still a lot of folks having to spend a whole lot more time at home.
Well, just be a little bit mindful of the different safety. I think on a whole we are, but we just have to be a little more vigilant in terms of this example. If you're going to put a pot on the stove, make sure it's high enough that a little toddler or something can't grab it, off there. Make sure that there's plastic plugs that protect the electrical outlets. Make sure if you're gonna give your little child some warm cereal or soup, that it's not too warm, that if it does spill, that it won't it won't injure them too much. And just be careful. We just watch them while they're eating it and make sure that they're not gonna pull it off the table and potentially spill it on themselves. But just basic things, just to be more vigilant.
Dr. King, we had a question via chat that said that you had mentioned just now that there was had been an increase in pediatrics in the Burn Center, and that that had been reported in the literature. Where would that have been reported, and can you give us a sense of how the numbers and how maybe they've increased?
Okay, this was basically, we saw this from about late March to about May. And then it kind of dissipated because I think the regular school year, a lot of kids would be out of school anyway. right? So we reported this to the Journal of Burn Care and Research. That's one of our premier journals that is sponsored by the American Burn Association. And we saw a significant increase normally compared to last year. So I believe it was a statistical significant increase. I can't give the numbers offhand, but
Okay.
definitely a significant increase in number of monthly burns that month,
Right.
pediatrics.
We have another question via chat as well. Burn treatment, as you clearly know, is very hands-on. How has your COVID practice changes affect your functions in the burn center? What are you having to do differently?
Actually, well, some of the things that, first of all, every patient that comes into UNC Hospital gets a COVID test, right? That's the first thing. So, and if we, a lot of burn patients, obviously, probably the majority of burn patients going to need some type of surgery, if not debridement and grafting. Those patients must have a COVID test, a negative COVID test before they go to surgery. Now, if they do have a positive COVID test, then there's a whole bunch of precautions, in terms of PPE and in terms of how we manage the rooms, how we do, air exchanges and so forth that have to occur. And then the big part of that is transport, because when a patient tests positive for COVID, they go in to the part of the hospital where we've been cohorting these patients, and to transport them from there to the operating room is a big thing. So those are some of the things that we have operate on. I think to date it's about 7 or 8 COVID positive patients, and I believe 3 of them have been pediatric.
And so if a patient comes in and they've had a severe burn and they do test positive, they don't stay in the burn area. Is that what you're saying?
That's correct. They're trying to, they have a separate area, pretty much where they have quarantined the COVID patients. Now, we haven't had a severely burned COVID positive patient yet. And obviously that will pose a lot of different challenges, because we would have to, of course, you talk about the hands-on management. There'll be a lot more hands-on management, but we'd probably have to do that in our COVID ICU, which the nurses wouldn't be familiar with necessarily managing patients. That means we'd have to send our nurses to the bedside to help manage that. So that would be a difficult situation. So far, we've had fairly stable, and in majority of, in terms of the COVID, they've been asymptomatic in terms of their presentation.
Oh, do you recall on what the ages might have been? It's been in younger, older?
Yeah, so it varies. We've had some adults, young adults. We've had some pediatrics. I believe in the area around a little older than toddler, around 10 or so years of age, and then we've had some older adults. So it's gone the spectrum in terms of ages. In the 8 patients that we've taken care of.
Right. So we do, go ahead, Alan, go ahead.
I was just going to say, part of your role is doing some outreach and education, raising awareness with fire departments around the state, EMS around the state, to try to, create prevention. You don't want people coming in to see you as much as you can help it. How are you coping with that, with the pandemic? How are you getting out and about?
Well, that's an interesting question, because we actually been hampered in two respects. The first respect is our main outreach coordinator just retired. He Ernie Grant. He'd been here years. He's well known within the community and within the state and internationally. Actually, he's currently the president of the American Nurse Association. So he left here for a much bigger position. So we've actively recruiting for this position currently. So that's one respect. And then the COVID, obviously, there's really not opportunities to go to the firehouse and to go to different medical facilities or go to different other facilities to do face-to-face, hands-on type of training. So what we attempted to do is do a lot of this outreach virtually. Example, when I took my position here, I reached out to a number of the EDs that referred to us, and I was able to set up some virtual meetings just to let them know that we would continue to obviously support them and also try to do as much training virtually as we can. So that, but it really has affected our outreach mission.
Question came in on chat. Holidays, particularly July 4th, but also Halloween coming up are typically, you see a surge in patients with burns. Did you see more or less this year on July 4th as fewer folks were gathering? And what's your expectation looking ahead?
Ironically, we've had, I think, a record number, 19 admissions on July 4th. I think the previous record was in the area of the middle teens, and in this one, it was the highest. And I don't have a good reason for that, because there obviously it wasn't a normal year for July 4th, but I think a lot of, we just got out of a shutdown and they had released some of the restrictions, and I think people took advantage of that opportunity, and they did the normal thing. I don't think, I think that's what happened.
Do you think maybe because there was not as much organized, say, fireworks on July 4th this year, was it maybe a do-it-yourself thing where people went across the border or wherever and bought their own fireworks? I mean, is those the types, when you see the injuries on a July 4th, what types of injuries do you typically see?
That's a good point. Majority injuries were related to fireworks. There were a few injuries related to, alcohol and, grilling or bonfire type activity. But a majority of them were related somehow, in some form, to fireworks. And like you said, it wasn't organized fireworks. It was usually, the patients were doing some type of fireworks in their own.
The cul-de-sac.
Yeah, so that's a good point. And we did, that was in the discussion when we kind of look back on the holiday.
We do have a couple of media folks on. We've got Spectrum News, we've got Rose Hoban with North Carolina Health News, and then Brian. Is Brian still on? So if you guys have any questions, please just step right up and ask, or you can also put those in the chat function for us as well. So if Spectrum, if you've got a question, Brian Rainey, questions, please go ahead and ask. Quick question I was thinking of too. So you've got a long military career, 20 years in the Army, a couple of deployments in Afghanistan and Iraq. How would you say that experience that has prepared you for your role here with the Burn Center?
I definitely say that experience, and then obviously the patients that taken care of a little bit different. Although when I was director of the Army Burn Center San Antonio, earlier when I first got there, we were seeing majority of military patients, but of combat wounded. And then as we got past 2012, we saw mostly civilians. We were the regional burn center for South Texas, so it's still a lot of the same. But I think in terms of leadership, I think I learned a lot from the military in terms of leadership, and that's helped me definitely in this role.
Looking ahead to the winter, lots of folks stuck at home. They're going to build fire pits. They're going to socialize, in their backyards. Any advice for what they need to be aware of as they're doing that, just to avoid coming to see you?
I think the main advice is that, big fires and bonfires and alcohol don't mix. So people need to be mindful of their alcohol consumption, because usually when these type of accidents happen is because someone's drunk and they're getting either too close to the bonfire, or I even had some people think they can jump over the bonfire when they're drunk, and it turns out not to be a good idea. And then the thing to also remember that, you're impaired. So if you catch on fire, normally your, judgment would tell you, try to put the fire out or, but when you're impaired, you don't act quickly, and that makes the injury all that worse. So definitely alcohol. And then the other thing would be, if you're going to do some outside activities that involve fire, make sure you have a fire extinguisher available and readily available, that in good operating condition. So if something does happen, you can easily extinguish the fire.
And could you talk about the importance of not only having a fire extinguisher, but knowing how to use it?
Oh, very important.
Properly.
What happens sometimes is that people have fire extinguishers there for years, and it's not in functional condition, or they don't know how to use it. The old pass, acronym with pull, sweep, and all those things I think are very important, simple things to know how to operate that. And I guess another thing just kind of related to that is the smoke detector. I think, most of the homes now have smoke detector by code, but I think it's important to make sure your smoke detector is functional. Make sure you change the batteries. So those are important. It's useless to have a smoke detector in your home if it's, the batteries are not working, or the smoke detector itself is defective.
Someone sent us a chat question and said there's also an upsurge in the number of tall gas heaters that are being deployed, so much so that you apparently can't even get one because they're selling out. I'm not sure what's behind that, but any thoughts on that, on the correct safety tips and use of gas heaters?
Well, I think a lot of the safety tips are actually tips, and in the right situations and environment, use those. Obviously, we're just coming out of the summer, so we haven't seen a lot of that. And then when I first got here, in terms of the winter, we didn't have a horrible winter, so I didn't see a lot of those injuries when we first got here. But it's definitely something that you need to just be mindful of, the different conditions and where you're using those, and those type of heaters.
The Burn Center in Chapel Hill is really a destination for patients from across the state and even beyond. Could you talk just a little bit about some of the innovations in treatments that you've seen in recent months and years?
Well, one big innovation is a product device called ReCell. And basically what this is it's a little device that allows you to, you harvest maybe a postage stamp size of a patient's skin. You're able to dissolve that skin, and you're able to create a solution where you can spray on a wound, and you can spray an area that's 80% or 80 times the size of the harvest that you made. And UNC was involved in, it was a multi-center trial that finally got this product FDA approved. We were involved in it. Also, Dr. Holmes, he was actually the major, he was the what do you call the main
Prime investigator.
And he was involved in the study as well.
What does that mean for patients? Is it faster recovery? Is it just better outcomes in general?
Well, outcomes still, I think we're still studying that. What the study was able to show is that the decrease in the amount of what we call donor site, or the patient's skin, that's needed for, other outcomes are harder to, we need, larger, more studies to kind of flush out in terms of like survival and, length of stay in the hospital, those type of outcome indicators. But one thing it does do is it gives you an opportunity to cover more of the wound. And this is important because in burn, especially with these large burns, the key to survival is to cover the wound in the shortest amount of time possible. So if someone has a 75% burn, what's going to kill them what's going to lead to their death over time is infection. Because if we don't get the coverage that we need and the wound gets infected, the patient, gets septic, their organs start to fail, then that's how they expire. So the key to survival is to get wound coverage, I think this is giving us a tool where we can get that wound covered a lot quicker.
Hope another media might step up. Sorry, Dr. King. Dr. King, your world and the nurses and doctors you work with, it takes a special kind of person to work with patients in these kinds of situations. Can you just talk a little bit about that? How you keep morale up, how you keep folks focused on the mission, and what you hear from patients after they've gone home and successfully gotten back to their lives.
That's a very good question. It's very difficult. Burn is unique in that it's really can be stressful, not only on the physician providers, but mid-level providers, as well as the nurses and all the other, because the patients, especially with these larger burns, require a lot of resources, manpower, and they stay in the hospital longer. So just to give you a sense, the average length of stay for a burn patient is 2 to 3 days per percent burn. So if you're 50% burn, you're looking at 150 days. That's just everything goes well. And there's no complications or snafus or anything, which, in a lot of cases doesn't happen. So, the average patient, say a trauma patient, may be in the hospital for a month, where it's our, badly burned patients may be in the hospital for six months. So, obviously that's a stress on the family as well as the medical team. And the other thing is these patients need a lot of surgery. They have to go several operations. So that patient with 50% burn may be going to the operating room 15 to 20 times before they're, ready to go home. And then they may require additional surgeries as an outpatient for other cosmetic or, because of scarring and stress. And I think we often say that, in terms of nursing, right, and our physicians, if you don't like burn, you're not going to stay in burn. So the people who have stayed in this a long time is because they love it. They love what, the challenge of it. They love taking care of the patients, and they love, the feedback that they get. And I think you talk about the patients that follow up. A lot of patients, they show their gratitude, and the biggest reward for us is for a patient who had been in the hospital a long time, and they show up and they're starting to live their lives, they're starting to regain their normal day-to-day activities. And that's probably the best, inspiration and motivator for us.
The innovation you mentioned with RECELL and other things that have happened over your career, do you see pretty big advances in terms of which patients are able to survive, which patients are able to get back to their lives?
Yes, and I think because of things like RECELL, because of studies and products like RECELL, and there's a whole host of other looking at the burn wound at molecular level and trying to decipher, what happens as the burn progresses, or what happens at a molecular level to the skin when it gets burned, or the body when it gets burned. I think one area that has eluded us probably is elderly patients with large burn. They tend not to do well, and we haven't really put a dent in that. We put a dent since, if you compare, let's say a 20-year-old, with and 80% burn. In the early 80s, and definitely the mid 70s, their mortality would be about 70–80%. But now, those patients, majority of those patients are expected to survive. So that has made and that advances not only because of what we do with the burn wound, but because of what we do in terms of the critical care management of those patients, in terms of the ventilator management, in terms of how we manage, other things, their kidney function and so forth, right? But the one area that we haven't really made a big dent in, and hopefully something will come out in the future in research and studies, is elderly patients with large burn. And that's going to take probably, the key to that is just, we need something, we need a product that we can pull off the shelf that we can put on the patient and it becomes skin. And that's the holy grail, I believe, of burn medicine, is an off-the-shelf product that we can put on a patient and it'll grow and becomes the patient's permanent normal skin. We still haven't got there yet. We're almost there. I think in the next 5 years, we may have that, but through stem cell and other types of research, but we don't have that yet.
Let's see.
King, another question came in on chat. Reporters interested in, what do you see more of, burns from fires, from hot liquids, electrical?
It depends on the population. So just to break it up, pediatric versus adult. Pediatric patients, majority of their burns are scald, due to hot water, maybe the bath was too hot, or they pulled a pot off the oven or stove, or they spilled some soup on themselves. So the vast majority of pediatric burns are scald burns. For adult populations, probably a good portion of those may be flame, but probably even more is related to like grease and cooking, or using accelerants to burn trash, or even sometimes even cook it. So that just gives you a range of different types of injuries, but a lot of it is depending on the age of the patient, pediatric versus adult.
So accelerants are another issue, another thing that people should probably try to avoid.
Try to avoid. I would say try to, if you can, avoid burning trash. I know some places the sanitation department may not come on a regular basis, and it may not come at all in some areas. But if you are going to burn trash, don't use accelerant. Especially not something like gasoline or something that can combust very rapidly. And usually what happens is it combusts, the patient's clothing gets ignited, and then you have an injury. Hopefully you can extinguish it early, but a lot of people, they may panic and run, which makes that situation even worse. So if you can avoid using accelerants for burning trash, I think that would be a big preventive measure.
Well, we're almost at 9:30 right now, so we'll just ask one more time. Any media with questions? If so, you can just step right up and ask, or you can send us a quick chat, and then we will conclude today's media briefing. Any additional questions from media? All right. Any final thoughts, Dr. King, on what's most important for consumers, for families? What are the biggest preventative measures that folks can take?
I just think just be vigilant and mindful. Burn injuries can be devastating. I just think you just gotta be careful. Like, pay attention to the electrical wiring in your home. If you have young children, be vigilant of burn injuries that can affect them. When your outdoor activities, bonfires and grilling, just be. I think if you have that extra mindfulness, a lot of these different injuries can be avoided. So just a little extra attention and just realize that when things happen, and they can be devastating, you know, and I don't want to see any of you in my burn center, you know, as a patient, but we're here. If it does happen, we're here. You have the full support of my staff, and we're going to try to get you and your loved one, you know, back to as normal activity as possible. That's our mission, and that's what we live by. That's what we.
And I did see one more media question that I stepped over. What would you say is your biggest challenge now in this new role?
Well, my biggest challenge is just in terms of leadership, just managing. I got a great group of people that I work with, but each section has their own individual challenges, and I see my role as mediating that and trying to alleviate their obstacles and challenges so they can do their job as well. And you know, and my thing is, I want all my staff members, you know, doctors, nurses, physical therapists, I want them to come to work with a big smile on their face, ready to treat, you know, your loved ones and dedicate their, and not have other issues, your bureaucracy or whatever to hinder that. So that's what I want to do. That my job is to worry about those other issues, and I want them to be free of those concerns.
That's great. Well, thank you. Well,
you're doing.
Yeah, we're 9:32, so we're out of time. So thank you, Dr. King, so much for joining us. For folks on the phone and on the call, we will provide the video and the audio files for you through a Dropbox, so you can download those. And then if you would like it, we can actually email the audio because that one's not too big. So thank you so much for joining us today, and that will conclude the UNC Health Media Briefing for today. Thanks so much.